There's a workforce crisis in cardiology. About 1/4 of the cardiologists in the United States are slowing down and retiring, and we need to have enough people to replace them. And every year, we have more people who want to go into cardiology than we can serve. There are only a certain number of fellowship positions or spots that are paid for by the federal government, and that's true for all training programs.
Often the limiting factor isn't the fellows, it's we don't have a spot for them. I mean, sometimes we are really want to keep a particular fellow, and there's just no spot that year, and we have to reluctantly let them go somewhere else with the hope we can bring them back.
In order to get an additional position, we came up with the idea of funding through the foundation an additional spot in honor of Dr. Prystowsky.
When they sat down and said, here's what we'd like to do, honestly, I was flabbergasted. It's a very humbling thing when somebody wants to name a fellowship after you. This has nothing to do with Eric Prystowsky. This has to do with our group training fellows at the highest level and providing excellent care for patients in the state of Indiana. We have a very high-level training program. Our trainees often finish in the top of the country in a national test they take. They have 100% passing of their boards. They're really high-level clinicians. These are the cardiologists you want to be taking care of you and your family.
General Cardiology Fellowship is 3 years long, so you're really kind of focused on everything within cardiology and trying to get a good knowledge base of all of general cardiology during those 3 years. We try to incorporate every new technology, every new technique, every new thing that comes out. You know, we are on the forefront of a lot of the research of a lot of that stuff. We have the unique ability here to train good cardiologists and hopefully support our local ministries with the cardiologists that we train, which we have a very good track record of doing.
50% of our trainees stay here in Indiana, often with the Ascension system. So Kevin trained with us a number of years ago, and now he is doing what we did with him. He's become one of our teachers and faculty, and so the cycle continues.
This is not just a hospital system where we see patients. We are raising up the next generation of physicians. If you've never found a reason to donate to the foundation, this is it.